Okay, hello and good evening, everybody. Welcome to this session. Today, we are going to deal with few of the other aspects in the data care or the healthcare data analytics. Right. So let's get started. And this is the second module of the four modules that we have in this semester and for this course. And this module deals with hospital data sources and interpretation. Where are we going to get the sources of the data? I think hospital will generate in our previous classes. We have also looked into hospital is generating a lot of data, but we will find out what are the true nature and also the sources of the data, and then we will spend some time on the interpretations too. So let's look at where are we going to get a lot of data. I think one of the rich parts of the data source is the OP or the outpatient data indicators. What do you get here? If you look at it, OPD, as it's already called or known for or famous for, this outpatient data is the place or is a point where you are going to get or design for the treatment of outpatients who will not really require to get admitted. So these are the people who just come and they have the consultancy and then go away. You're not going to admit them. That's why they are called outpatient. They're not inpatient. So outpatient data is a data where you will not going to monitor them for several nights, or they are not going to stay with you for overnight. So who are the staff that are involved into it? If you look at it, so outpatient data will have executives, assistant manager, lab staff, pharmacy, billing staff, diagnostic staff, all of them. So each of these people, yeah. So somebody is trying to join. Let me just admit. Okay, so we were talking about the different parts of the outpatient data indicators. We started to look into different types. So first and the foremost thing you have to keep in mind, the outpatient data indicators are different from the inpatient. Inpatient are the ones who are going to stay in the hospital with you under the supervision of the healthcare staff. But whereas the outpatient data, as the name suggests, they are the ones who are not going to stay with you overnight. So there are a lot of people involved even for outpatient. Just because they are not staying doesn't mean that they will not come across these kind of staff. So you will have a lot of OPD executives, assistant manager, lab staff, pharmacy, billing staff, diagnostic staff, and so on. So what are the typical functions? uh, you will have first and the foremost thing is the appointment. Do you have an appointment? Did you take an appointment? Is it an online appointment, or is it over the phone, or is it walk-in? Anything is possible. Sometimes some doctors allow you to have online appointment. Like if you call up KIMS hospital, they have this wonderful system where you can insert the details of the patient, and then they will call you back and tell you what is your sequence number, when you are supposed to come, is the doctor available, all the details they will tell you. You will also get an email notification. So appointment is the key in the OPD. Outpatient data, you will certainly going to get appointment. Then comes the billing part. What is the billing? So you are going to pay the consultancy fees. The consultancy fees would range from anywhere between 200 rupees to it can go to up to thousands of rupees. It it is purely on the basis of the type of ailment, type of consultancy that you are looking for. Then the whole consultancy, you go and meet the doctor. They will give you time. They will listen to your queries. They will write some prescriptions. They would also suggest you some diagnostic, and then it goes to the lab services. What are the lab services? If you have diagnostic test as recommended by the doctor, then you go for lab services. Otherwise you may not. And then the pharmacy services. Is there anything that you would like to add to the functions? Are we missing anything? Anybody? Srija and Monica? Are the services fine? Yeah. I'm talking about, is there anything that we are missing in the list? These are the functions of the OPD. Which one? Go ahead, please. Billing, appointment, consultancy, lab services, pharmacy, anything else for the OPD?
Diagnostic staff.
Diagnostics will come in the lab services.
Yes.
Okay, let's move on. Good. So these are the performance measurement. I mean, lots of performance measurement will come into play as far as the OPD is concerned. So performance measure or performance measurement are done through structural way, through the process, and also outcome indicators. Let us look at the operational excellence indicators. One is the appointment system. How good are the appointment system? Are your hospital able to give you easy appointments, or is it tough to get? So you have lots of hospitals. Yashoda, you have KIMS hospital, you have AIG hospital. A lot of them. Look at their appointment system. Is it very transparent? Is it clear, or you have to struggle to get appointment, or even after going online, you still have to call them up? Is that so, or is it very transparent, or it's also easy? The ease of getting an appointment. Internal transportation, how are you being transported from one place to the other? Do you have lifts? Are you going to be taken to a stretcher if you can't walk? Right from your parking to the hospital lobby to the consultancy room, how is it possible? And the consultant effectiveness. Are they able to give you time? Listen to your queries. Do they understand what you are saying, your symptomatology, all those things? Then look at the OP, outpatient total turnaround time. Outpatient total turnaround time will comprise of everything under the roof. Turnaround time will come from the waiting time to the minor to the pharmacy to the billing, everything, all that. And what about the incidents? Patient safety, work related incidents. Are the chairs good? Well, they were not good. Do patients have to stand, sit? Can they really relax? Or the time taken is more? And what about the outpatient prescription documentation audit? Do you have, how do you maintain that? Is it computerized or is it handwritten? Do you scan and keep it in the record? How are you storing that documentation? Then the facilities and the equipment. Do they have some equipment? If they want to check the patient, do they really have beds? Do they also have some other equipment to test it? Not the diagnostic equipment, remember this. The facilities could be washrooms to clean water, uh, potable water, drinking water, washrooms, seating, waiting area, the lift, parking, all these are facilities, and also their equipment. So manpower staffing, are there structural staff? They have training, are they compliant oriented? Okay, someone trying to join. Yeah. Look at this one. So do they really have compliance? It's not just about training, but are they also compliant oriented? Do they follow the norms set by? Okay, people are still joining. Okay, we're already joined. Okay, so we were referring to the training compliance and their effectiveness. A good trained staff will be able to resolve the problems of the OPD patients. This outpatient data sources are rich only when you have a train, and their effectiveness will go a long way. Then the satisfaction indicators, or the indicators or indices or index, you can call it. So what are the satisfaction indicators? All the three stakeholders, all the three. Who are the three stakeholders? If you look at it, all the three stakeholders we are referring to. Like first and the foremost thing is the staff or employees that you have. Then the doctors, then You have the patients. Are they happy? Is so in hospital, is your staff happy? Are they satisfied with the services that they are offering? Are your patients satisfied? Are the doctors who are coming on the consultancy board, are they also satisfied? That's the thing. So you get a lot of data about their satisfaction. This is more psychological, but at the same time it can also check the and emotional part of it. So the physical facilities facilities to the emotional connect that you will have, right? So the emotional part of emotional aspects of both, or all the three. So it's a triangle if you look at it. So you have staff or employees, and then doctors or consultants, and then the patients. That's how it is being constituted. Then employee attrition rate. What is attrition? Anybody? Attrition. Hello, everybody out there. Just all of you, Simi to Mahita to Monica. What is attrition?
Appreciation, sir. Sir, appreciation.
Okay.
Appreciation, sir.
Attrition, attrition. Look at the attrition, this one. ATTRITION, attrition. Attrition. That means the rate at which employees leaving the organization. And then you have to fill that, fill the vacancies also, right? So if you have 50 staff nurses and in a year 25 of them have left, so what is the attrition rate? What is the attrition rate, ladies?
25, sir.
Yeah, the number is 25. Percentage? What is the percentage? 50%, no? Isn't it?
Sir.
So 50% is,
Yes, sir.
yeah, so is 50% attrition good or bad?
Bad.
Worse, isn't it? It's really bad. So certainly it's bad. So if people are living, that would also indicate every time you go there is a new nurse. Every time you go that there is a new staff uh, person in the office. There is, so that's not. What is the industry standard? Industry standard could be less than 10% of the attrition. That's where you have to be careful. Okay, we are referring to that. That's the employee attrition. Remember this word, attrition. In attrition, you are trying to fulfill or fill the vacancies. You're trying to. But what happens in layoff? Anybody for layoffs? Layoffs. You heard of this term, layoffs? You hear in IT they have laid off. So what is layoff? Difference between attrition versus layoff? Anybody? Simi, Monica, Shantika, anybody?
No idea, sir.
Yeah, in layoff, if people are removing you, they will not fill that vacancy. Okay, so if you have 50 nurses and you removed 25, so are you going to fill these vacancies? If you're not, then it is layoff. Okay, and if they have left on their own, they have vanished on their own, they went away, then in that case it's attrition. Okay, remember that. Okay, and what about the complaints recorded? Do hospital gets complaint? I think yes. That's why you have the
Yes, sir.
yeah. That's why you have the suggestion boxes at prominent places. You get them. So all these complaints are also recorded. So they can act on these complaints. There can be complaints related to physical facilities. There can be complaint related to the waiting time. There can be various kinds of complaint. Then the clinical indicators. Do you really have all the facilities? as far as the clinics are concerned? Do you have sufficient space inside? And then what about the aesthetics? All those things. These are the performance measurement. Now let's come to the business development part. This is where the top management is interested. So outpatient to diagnostic conversion is important. How many of the outpatient, let us say, if there are 100 outpatients who come, how many of them you have referred for diagnostic tests? That's the business development. They may have problems, they may need some diagnostic intervention. So this is the business development indicator. Then what about the outpatient to lab conversion? Sometimes you have to also give them to the labs. So you can come to the lab. So outpatient would also visit to the lab. So urine test, blood test, and so on. Apart from the diagnostic test, remember. And then can we convert OP to IP? In many cases, what is the answer? OP to IP.
Sir. Yes, sir. We can convert.
Yes, we can, because if the disease, yeah. So in many cases, when you have outpatient who comes and then they become inpatient because suddenly they realize that they are having severity, the disease is acute, and hence that will be converted. That's what it is. Pharmacy utilization rate, you have inside hospital pharmacy, how many people are using it, how many people are purchasing it? 100 patients are coming, but only 50% of them are buying the pharmaceuticals from the pharmacy, in-house pharmacy. That's one. Lab utilization, you have lots of laboratory, are they being utilized, or just as a cost function they are functioning? Then the bonds and stock outs at the pharmacy, and then the net promoter score. The net promoter score analysis, NPS, is nothing but how much that you are able to promote as well as your, yeah. There are some children who are shouting, so let me just mute it, and then you later on you can yes. Okay, so this is the one. Let us look at the demographic and geographic data analysis. For outpatient analysis, demography and geography are also two important data analysis. What is demography? Anybody? What is demography? You know,
The
demography. Yeah,
statistical data of birth,
yeah. Go ahead.
death.
Okay. Mahita, you're right, but it is in general, yes. It is nothing but about population. Population studies is called demography. So the population will be studied through statistics. Yes, you're right. Like their age, gender, income, education, right? Urban, rural, where are they coming from? Urban areas. Who are the patients who are coming? Rural areas, right? Educated. All these are demographic. And then the geographic, different parts of the places. Are they coming from the villages? How far? Do you know how many foreigners come to Hyderabad for treatment? What is on an average foreigner coming to Hyderabad? A lots of African nations are coming to Hyderabad, African countries for treatment, including Arab nations as well. Many of them. You can see in Apollo, you can also see in KIMS, you can also see in Yashoda, you can see in the corporate hospitals. They also kept interpreter to help them. Those things. Okay. So you are going to collect and analyze the data or based on their people and population. Population is an important part of it. So when you say population, population can be how many children are coming to OPD, how many women are coming, how many old people are coming, how many males are coming. So demographic data that you are going to capture, first and the foremost thing is the name, age. Which age group is coming largely? Age, gender, race. Where are they from? Are they coming from Adilabad? Are they coming from Bhupalapalli? Are they coming from the tribal region? Are they coming from urban region? Ethnicity, right? African people who are coming, different ethnicity. There's socio-economic data as well. What is their income? How are they going to pay the bills? What is their father's income? All that socio-economic data as well. So the demographic data. Geographic data you are going to capture is through the address. Address will have a particular place, right? Are you from Punjab? Are you from Jharkhand? Are you from West Bengal? Or are you from the Andhra region or Telangana? All those details. Okay, let's move on. And it also helps the healthcare team to communicate effectively and understand the patient culture. It's important. So suddenly they come to the corporate hospital and there is nobody to speak in Telugu, or nobody to speak in Urdu, or nobody to speak in Hindi. It's tough. So communication can happen with the understanding of demography and geography. If more and more patients are coming from the Telugu region, then you will have a lot of Telugu speaking managers, staff, nurses, all of them. They will help. They will try to make bond with them. And it's also useful for marketing sometimes, business strategy. So you can go and establish or market your hospitals. So in African countries, Apollo is famous, KIMS hospital is famous because they are treating them. The word of mouth will become important. You can also plan for future. You can have a separate wing for the foreigners. They don't really have to wait for you know long appointments. You can easily get speed appointments, tatkal appointment kind of thing. A specific marketing and operation strategies and improvement can be done based on the data analysis. See the difference. If you know the statistics, if you know the data, then it helps you to reach out to more people and hence grow the business as well. That's how it is. So there is also this lots of other, OKP method and the smart KPIs. These are the some of the methods that you have. Key performance indicators. It's called KPIs. You have you have the smart KPIs. That means specific, measurable, achievable, relevant, and timely. So OKP or OKAPI method is by Iris Seiden and Maya Gill using smart KPIs. They are one and the same. OKPI method is based on smart KPIs method. So what are the indications? Appointment system, internal transportation, consultants effectiveness, all that we have looked into it. Complaints recorded, clinical indicators, everything. So you can clearly see how it is being done. Okay, let's look at the internal transportation. What is internal transportation? Okay, someone is trying to join. I will admit. Chavan Jayashree. Okay, so tell me, what is internal transportation? Internal.
Transfer of patient from one side to other side of the hospital, sir.
Yes,
Inside.
yes. Correct. That is the process of transporting patient within the OPD. So you go to the reception and the reception says that, okay, go to third floor. If you want to go to neurological department, the neurology is on third floor. Cardiology is on the second floor. Everybody will meet at the reception. They pay the consultancy fees. They make the record and they will be distributed. They will be going to different directions. Sometimes you have to go to a different block. You say it is in block 1. block 2, block A, block B, so and so floor, so and so room number. And the OPD patient may or may not be able to walk. So you need to provide them equipment like stretchers, wheelchairs, all that. So the indicators of this outpatient, you will have to maintain the quantity, how many of them, how many numbers. You have to also have good maintenance. Sometimes there may be a delay, like during the lift, you have to wait for a longer period. Sometimes the lift itself can take 10 minutes. If it is a 11-story building, by the time it goes to each floor will take 30 seconds and then it comes back. There might be delay. And you have to be careful with the any untoward incident should not happen. What about the equipment status? So the equipment status could be the quantity, right? Maintenance and safety. Are you really properly using it? Are you maintaining it? Is your equipment safe for the usage? Or this, or some of the patients might also have some migraine going through that scanner, going through this equipment and so on. And then the number of indicators are the number of dysfunctional equipment and repairs. So this will indicate, are there some stethoscope which are under repair? Are there some beds which are not good? Are there some of these equipment not in use? There is some technical glitches, all those problems. What about the delays and untoward incidents? What are causes of the delays if you look at it? Non-availability of the equipment. Suddenly you see that it's not available. Sir, it is not available in our branch. It is available in other branch. So you might have to wait for it. And that person has not come, sir. The person who's going to take the ECG, or you are going to get this CT scan, that person is not available. It can also be delayed. They said, come tomorrow. You have to go again. So this will be the causes of the delay. Then the measurement challenges, you may not be, if you can't measure it, you may not fix it. Are you seeing how many times in a month that this person has not come? Are you measuring it? How many times these delays are happening? Is it a regular feature or is it happening once in a while? Untoward incidents, impact on patient and staff. Suddenly there was a power outage. The lift is not working. The lift has come to a grinding halt. Oh my God. And the patient is stuck into it. There is no breathing space and so on. You have to call other staff members to lift. And the other thing is the performance indicator. Performance indicator is going to tell you how many number of untoward events have happened. In a month, how many times the lift did not work? What time you have taken to repair it? Why is it taking more time? Why the number of times that the lift is not working? Why the equipment is not working? Why that person is not coming? All those things. Okay. So how do we fix the delays in internal transportation and through the personal arrival? I think the head of the department plays an important role. So head of the outpatient data services, outpatient department plays an important role. And he or she is responsible for all the delays. So how do you improve it? Like through, there are a few examples. One of them is through improved scheduling. Schedule as far as possible. Take the appointment, fix the appointment. If the person has not come within the next 15 minutes, give it to the next person. You can always communicate. You can communicate through WhatsApp, SMS, sometimes directly by calling them. So there is no delay. So if the doctor is not coming, but yesterday, that means the last day before, you have taken an appointment and you were feeling that the doctor is available, even everybody knows it. Suddenly there is an emergency at the doctor's place, consultant place. That can be indicated. And he calls up the hospital. Hospital can call up all the people in the appointment list for today, telling them the doctor is not coming, please do not come. Look at the better communication, the better it is going to be. Now, what about the maintenance plan for the internal transportation and equipment? You have to give a lot of priority to the equipment maintenance. How often you're doing it? Is it done on AMC, annual maintenance contract? most of the sellers of the equipment can also come and help you with the maintenance, but it is the responsibility of the in-house staff to look after the equipment. And then how are you implementing it? Are you cleaning it every day, once a week, once a fortnight, once a month? Are you taking care of the electricity, charging, batteries? If there are some equipment which run through batteries, are you taking care of them? All those things. So you can have regular audit, you can also go for repairs, you can calibrate if things have changed. If earlier it was some other size, now it is different size. Maybe the beds have become little bigger or the beds have become little smaller, and then you have to also send your staff for training. That's how it is. What about the performance of the consultants? These are the doctors and the physicians. They are the backbone of it. Anybody who is coming to your hospital, they are coming to see the doctor. The doctor is in the hospital, but the important person is the doctor, physician. So they have to be given different cubicles or rooms. So they are the backbones. What are the indicators or indicators? One is the availability. Are they available all the days of the week? Once a week, twice a week, thrice a week, 4 times a week, 5 times a week, 6 days a week, half day. Even if they come 1 week, they are coming only half day. Morning 9 to 12, morning 9 to 1, 10 to 1. Availability. Availability is up. Are there delays every time it happens? The number of patients are more, hence your number will get delayed. Time taken for consultancy or consultation, probably some doctors forget that there are other patients who are waiting and they go on and on and on and on and talk, and the other patients have to wait. So these will indicate. So the moment you enter, the receptionist might tell you your appointment is going to take more time because the doctor is already speaking to other patients. That's why it is. Availability of the physicians, of course, the importance of consultants' presence during the consultancy hours. Non-availability concerns, they are not available, they are traveling, they are not out of town, they are in summer vacation, they have other issues, all those things. And what is the mechanism for data collection and analysis? So please do collect that. Look into it. One doctor, neurosurgeon, how many days he has come, you have the data to capture, how many hours he spent or she spent, those things. Delays, impact on the waiting time. Waiting time is full, right? And then always document it. It helps in the future also. So anybody who will call you for appointment, you can say, sir, please don't come at 11:30. Come only after 12:30 because it might get delayed by an hour. Okay. Then time taken for consultancy, right? Importance of the consultancy or the time for patient satisfaction, you will have it. Then recording the consultation times. At what time the patient entered and what time the patient has come out. A lot of them can also, make note of this thing. Common complaints and improvement for opportunities. There are plenty of them. You can get it done or you can improve. That's how hospitals will get improved. Okay, let's move on. How do we address non-availability and delay in arrival, which is not in the purview of the hospitals? It is always in the purview of the physicians, but information is key. So your area head or the head of the operations can help you. So somebody who's looking after the operations. So there are 10 departments in your hospital and all of them are available except two, then the head can actually going to resolve that issue. But you have to do it in collaboration because this is the data, right? So the outpatient department, you have manager, you have consultants, you have other relevant stakeholders, could be patient attendants, could be people who are helping at the security itself. So somebody is entering into the gate and the security stops them, and thorough checking. That means they are helping you to get this patient and they would not get crowded. At the very entrance, the security is trying to guide them. They are asking them to go to the OPD block and then get consultancy. Okay, that's one part of it. So the time around time or turnaround time, TAT. So the operational total turnaround time is very important. So look at the components of the turnaround time. Turnaround time can be calculated from the waiting time, minor OT time, pharmacy time, and the billing time. The entire thing. How much time does it take for an outpatient outpatient uh, you know people coming into the hospital? What is the average time? Anybody? Please indicate. So any idea, guys and girls out there? So if a person or patient comes to KIMS hospital or Yashoda hospital at, at the OPD, how much time does it take by the time he leaves or she leaves? Are you all there?
Sir, around half an hour to 40 minutes.
Okay. Half an hour to 40 minutes. So that is the turnaround time. That includes small waiting periods or minor, outpatient time, pharmacy time if at all you want to buy the medicines, and then sometimes billing. Maybe the billing might happen before, or billing can happen little late, mostly. So all these components will tell you the turnaround time. So if you happen to be the manager, uh, you would be interested where are the loopholes, where are the bottlenecks, how can I reduce the time? Wherever possible, can I reduce the time in the waiting period so that the patient doesn't have to wait? That's where at the pharmacy also, if there is crowd, can we increase the time at the pharmacy? Can we really dispense it early disposals? As far as possible, you have to just look at the prescription, give the medicine, and billing at the billing of the pharmacy. That can also be possible. This can be possible. So outpatient waiting time, these are the factors that is contributing to the increased waiting time. Like, what are they? Factors will always be there to increase the waiting time. The consultant is the major. The physician delays are usually the reason for outpatient waiting time delays. One is the delay, the other opposite of the delay, or probably the extreme of the delay, is the non-availability. You've been trying for last 3 weeks and the doctor is not coming. The physician is not available. One is the doctor or the physician is available, but it's taking 1 hour, 2 hours, 3 hours. You go in the morning and your number comes only in the afternoon. And then there are also issues with the scheduling. Suddenly you go, it's not just delayed, the doctor was there, but he says that I am leaving. It's 1 o'clock. He has appointment. He has meeting. He has surgery. He goes away, and you are just returned empty-handed without any consultation. Consultation hasn't happened. That's a scheduling issue. Okay, that's why it is. So, what is the minor, you know, outpatient waiting uh, time? Time from billing to procedure. So, this is a minor thing. You may not notice, but the procedure itself will take a lot of time. No, and everybody says that it's part of the procedure. And then it also varies from institutions, between institutions. There is always in the variation. So these variations are important part of it. So this is the minor part of it. Okay. Let's move on about the pharmacy. Look at, we are going into, micro detailing. That's why I was telling you. These are the micro details. It looks that I know all of them. Micro details. So right from OPD, patient coming in, to consultants consultation, to pharmacy, billing, etc. All this. So the pharmacy waiting time, time from prescription submission to medicine delivery. In some hospitals, the most crowded place is the pharmacy, the medical store, in-house medical store. So there is a huge queue, huge line, and except that other places the medicines are not available. So the outpatient will definitely like to take the medicine there itself because they might forget it once they go home, and in their locality they may not get it. So that's why they prefer to have it from the hospital in which they had the consultation. So time from prescription submission to medicine delivery is the time of the waiting time. Is a waiting time in general. Okay, so what are the causes of increased waiting time? There are plenty of causes. One is that they may have only little staff. There is only one person who is doing it. There are 10 patients waiting for the prescriptions to be delivered, but there is one person running around. There is only one person at the billing. That billing person may not be able to get agile. So what are the solutions? You should have enough staff. Personnel means staff. Personnel is staffing. So adequate personnel, more sufficient number of employees and staff are needed in the pharmacy. And you should also be able to demonstrate the standard operating procedure SOPs. And then are you using the technology? If you're not using the technology, if it is handwritten, it is going to take a lot of time. Manual mill means more time. You should be smart enough. So many pharmacies today they are using the best use of the technology, and they will have the printed bill what you have taken, and if the medicines are not available, then they also make a note of that. So this is the pharmacy waiting period. Billing time. The billing time is like, when was the last time you have been to DMart and returned empty-handed despite purchasing? Anybody who's been to DMart? Hello.
Never ever, sir.
Why don't you go to the DMart? You said never ever. Oh great. Why? Why? Because the billing time is more. You purchased, you went on, and suddenly you come to the counter, and then you realize there is a huge queue. The time to purchase was 1 hour, the time for billing is another 45 minutes to an hour. Does that happen at the hospital also? And that too in OPD? Shouldn't have happened, but things can happen. So time for queue at the entry itself to the service billing by the time you come out. So the doctor must have written about diagnostic test. So again you go to the billing counter, pay for the diagnostic test, then you go to the pharmacy bill is also added sometimes at the main billing space, or you have a separate counter for billing the medicine, all those. So these are the challenges that are related to the personal again. So billing time is also a problem of the staff. If there are more personnel, more staff members at the billing space, probably things can move on. So in hospitals, I think billing is an important area. In almost all shopping malls also, that's an important area where you're going to exit. You have taken doctor consultancy, diagnostic test, you have purchased some medicines from the pharmacy, all that has to be added up. You have to pay it. So some hospitals can have split bill. That means you pay the bill for pharmacy at the pharmacy itself, and you pay the diagnostic bill at the diagnostic center itself inside. Or sometimes it can be clubbed with the consultancy and the pharmacy together. That's one. Okay, and then how do we address the inflow and outflow mapping of the OPD persons? Look at this one. So I think you have assistant manager to do it. Some of you may be working as assistant manager, or even after this MBA in healthcare administration, you might be becoming an assistant manager in OPD. So your job, your responsibility is to look after the roles and different duties of the assistant manager. So you have to properly map it. How do you map it? How do you map? Because time taken, time around, the TAT is nothing but turn around time, turn around time, turn around time for the outpatient that you have. That's why it's important to look into it. Okay, so what are the strategies to improve the outpatient turn around time? Are there any indicators? Are there any ways? Anybody? The third one. Do you suggest any strategies to improve outpatient turnaround time? Okay, let us look at some of the incidents. What kind of incidents can happen? What kind of events that can take place? So the occurrence in the outpatient department premises, some of them can happen at the lift. Patient safety related incidents. There should not be any untoward incidents. There should not be any injury, harm, or unsafety. Safety is important. And work safety related incidents for the staff also. Staff should not be injured, should not be at the receiving end. That's why. So patient safety related incidents, like common incident, patient can fall suddenly. You have a ramp and you suddenly have, there are, the grills are not so good and patient fall while walking. You have wet floors. Most of the hospitals will have this marble flooring. Marble flooring can be slippery if it is a wet floor. So when you are doing a wet floor, you have to indicate it's a wet floor. Put up a board and ask the housekeeping staff, don't allow people to walk in that area. You should have some person to see that. There can be emergencies. Immediately you have to rush. Drug administration issue, suddenly you have taken a pill, pop up the pill, and you have become unconscious, or you have giddiness, or you might have experienced some other symptoms because of the drug administration, and it will overall impact the facility structure. So if some patient has fallen, and then the whole operation will become tricky. So people have to wait, and then by the time stretcher comes, and then you pull out the patient from the lift or from the floor, and until then, the movement of the other patient will be stopped. So everything will come to a grinding halt, and that is not going to be effective at all, right? That's all. So again, the business related indicators as far as this areas are concerned, because we are also talking from the top management perspective or from the development perspective. So business development involves tasks and processes for preparing the potential growth opportunities and supporting their implementation. So so that means, how are you trying to expand, make the process simpler, or you can have the growth opportunity. So if you have 10 departments, can be increased to 12. Dental was not there, and people are also coming and complaining about dental. So you have physiotherapy. Physiotherapy was not there. You included physiotherapy. And it does not include decision on strategy and implementation. So business development is at the middle level, whereas the strategy and decision making is at the top level. Strategies are made by the owners, proprietors, or the CEOs or the managers, whereas business development is at the middle level. That's why you have. How do we measure the performance of the business development? We can measure through trend analysis. Trend analysis is nothing but looking at the historical data. Last year, how many patients have come? How many departments were there? Based on that indicator, you will get to know the accurate picture of the outpatient performance in terms of the business. Okay, last summer we had 10,000 patients. Footfall was 10,000. This summer we have a footfall of 9,000 only. So why there is a drop in 1,000? We should have gone into 11,000, 12,000, but the slump is seen. There is a drop. There is a reduction. And business development activities also aim to improve the businesses, such as increasing the footfall. I told you about the footfall. And inpatient conversion. This is all about what we are looking at it today is about OPD. OPD data sources. Can we convert OPD into inpatient? Those things. That's the conversion. Can we also increase some pharmacy sales? Everything is linked. The physician must have given prescription, and through the prescription, the pharmacy sale can go up. And then the diagnostic test. They said that okay, go and get it done. Go and get this uh, vitamin D3, B12 tests, or lipid profile, anything, or this blood tests, isn't it? Just wanted to check your glucose level, the diabetes test. Okay, so those diagnostic services. Then also about the profitability, how much you are able to make the profit, because business development ultimately boils down to profit. Are you making profit? Are you not making profit? Those things. So looking at the income and profit trend analysis, income and profit trend analysis of the OPD patients can happen at various services. One is the income generated through the OPD services will indicate the performance of the OPD in terms of business. Which hospital do you think has the highest number of OPD footfall in Hyderabad? Which hospital has more OPD in Hyderabad? Anybody? Quick. That's a GK question.
Government hospital, sir.
Great. Yes. Yes. Government hospital will have more OPD footfall. Yes. Be it Gandhi or be it Usmania General Hospital. Yes, that's the one. But if you are into private hospital and you want to increase the footfall, then you have to be sharp, clever, smart. So that will also tell you whether you're doing good business or not. That's why it's important to look into it. Okay, and then you conduct this trend analysis of the income, that is the total income that you receive, profit generated over a period of time. That means first month, second month, third month, fourth month, third month, 12 months, 1 year, you will come to know. And then you analyze that income generated through pharmacy. So how much your income, you are getting income from consultation, pharmacy, diagnostic centers, and so on. That is crucial. Okay, and then by you can also do the income analysis by department or area. How do you do that? Analyze the income generated by each department: cardiology, gastroenterology, then you have neurology, then you may also have gynecology, obstetrics, maternity, anything, cardiology, gynecology, etc. Each department, and you come to know, okay, this department, gynecology, you are getting less patients, whereas cardiology, you got more. So, can we increase one more consultant? We have only one, or can we have two? Can we have three? So, consultant wise analysis is important to understand individual doctors. And one consultant, even if you have three, but patients are interested to go to only one consultant and they are not interested to go to the other consultant. And that one consultant who they are interested, you may have again delays because you have to wait a longer period of time, weekly. That's one. The other one is the income analysis. Income analysis by service area. So analyzing income generated by different service areas within the OPD, such as pharmacy, diagnostic, minor OT, all these areas. These are the service area, right? And then this helps the assessment of the performance of each area and identify area for improvement. If you have to improve the pharmacy, most of the medicines are not available, get them. Diagnostic tests, you don't have the equipment, get it. You can improve it. All that. So outpatient, all these things can be done. So what about the outpatient to diagnostic conversion? Can we do that? In what way? Let us look at it. So the importance of diagnostic services is crucial, especially for income generation. If you want to develop your business, you need to have, because you purchase the equipment, you must have invested heavily in the infrastructure, in the equipment. So you have to have some income generation from the OPD and support the healthcare institution that way. There are challenges that are there, like there is always this competition from other diagnostic centers. There are independent diagnostic centers. The people will go to the diagnostic center, people will not get it done at the hospital. They said, I'll go to Vijaya diagnostic centers. And nowadays, there are also a lot of diagnostics which can be done at your home. So, MedPlus can do it from home. So, those diagnostic centers. And it also differs in pricing. So, if you do it at the hospital, the prices are high and hence they don't want to do it. So the pricing, waiting time, quality of services, all that is going to matter when it comes to the conversion of the outpatient to diagnostic centers. So the diagnostic service utilization rate will measure the utilization of the diagnostic center. So you have so many things. You have ECG, you have CT scan, you have MRI, and but CT scan is not happening of late. You say that, okay, but we have the facility. How do we increase it? How do we increase the footfall into this service? And then you conduct the trend analysis of the income generated through diagnostic centers. Last year, how many tests we have done? What is the income generated? And this year, how many tests we have done? And what is the income we got it? Okay, so I think we will take up the laboratory conversion in our next class. We are